All right. Hello, dear students. Can you hear me? Can you hear me? Just 1 second. Let me check this thing. One minute, guys. We are just checking up the settings and these things. If at all everything is correct or not. Okay. All right. Good evening, everyone. Yeah, perfect. So, all right. Good evening, everyone. Welcome to today's session. So, basically, in this session, what we are going to let's start up with that. Right. So, I hope I'm audible. Just let me check for my confirmation once so that it won't be disturbance in the mid of the session. Okay, perfect. All right, all right. So, welcome to today's session. So, what we are going to do in this session, let me explain you people first, and let's see what and all we can cover in this session, right? So, dear students, in this session, what I'm going to do, major important drug overdoses which have been frequently asked in the FMGE exam, वो पूरा cover करेंगे. We'll be covering all the important topics or overdoses which have been asked. We will be covering. ठीक है? And उसके अलावा, apart from that, what we are going to do is that we'll make a what is that we'll make a concise the antidotes list at the end of every poisoning, and we will learn about the symptoms of every drug overdose and a poison or maybe poison, because when we are speaking of drug overdose and a poison, there are some poisons which have a similar property, जिनके अंदर क्या है similar property to that of a drug also. तो drug और poison के अंदर कई जगहों में same symptoms होते हैं, तो that is why I have included the poisons also, few of them. All right. Hello Kaushik, good evening. So, anyways, before starting that, let me tell you people. So, Team Meduhub is coming up with a beautiful rapid revision program of all the 19 subjects for you people, right? So, which will be there on our Meduhub app. You can subscribe to that, okay? And which is going to be like, till the exam, we'll be doing a rapid revision of all the subjects within a very short period of time. And at the end of every subject we will have some practice questions for you. So that questions is going to be कैसे होंगे जो important already पूछा गया है. Okay, मतलब previously पूछा गया है, possibility to ask in the upcoming exam. Okay, and we will be providing all the PDF of the material which we will be teaching also. ठीक है, so we will be doing all of those discussion. Okay, so this program is starting on 2nd of next month, that is June. So that will go till the exam time. Okay, so in that way what you can do is that you can revise all the 19 subject, you can do a test of each subject, and also you can have a rapid revision of each subject. That way क्या हो जाएगा कि आप लोग एक subject को खोल दे. For example, let's take pharma only. Okay, so we will give you the timing of the pharmacology, मतलब when pharma is going to be rapid revision. So we will give the date. Before that you can go through your notes one time, right? Followed by that, what you can do is that you can listen to our rapid revision session, and very next day you'll have one test also, you can solve it. Meanwhile, doing the next subject, meanwhile you do the test, and also साथों साथ क्या कर सकते हो आप लोग, you can also do the next subject rapid revision, ताकि आप लोगों को schedule भी बना रहेगा. ठीक है? So with that much being said, it's a highly recommended. This is not first time we are doing after a successful Sankalp program which we have done in the Meduhub, right? So like that only we'll be doing here this time also, but even better way and even a shorter duration of time. We'll not be doing like 10, 20 hours, 30 hours of rapid revision, nothing like that. A very concise material we'll be doing, okay? And we'll have a PDF of each of those materials, so that is a benefit for you. You can sit and add into that PDF or upload चाहते हो तो print out लेके भी पढ़ सकते हो, okay? So with that much being said, so the topic for today's discussion क्या है, हम लोगों के पास overdose आ रहे poison, mainly overdose के ऊपर है, but there are few poisons जैसा मैं already बताया था. So any time if there is a drug overdose, what will be there? Drug overdose, right? If drug overdose, if it is there, my dear students, what we need to understand, or if there is some poisoning, okay? So the first important thing I will be teaching you people is the common points to be remembered. What do I mean by this? So कोई भी poison आता है, कोई भी drug overdose होता है, what are the few important things which you look after for every poison? Okay, for every poisoning case, anytime, the first thing what you are going to check is check for your ABCs. Okay, so what do I mean by ABC? A for you are going to check for airway, B for breathing, C for circulatory system. You are going to definitely look at these ones. Okay, so then the next important, if there is a instability of the person who is like, you know, vitals are unstable, so vitals ko check karo, vitals ko monitor karo, vitals. Okay, so you are going to stabilize the vitals. Apart from stabilizing the vitals, what else you are going to look for? You can give most of the poisons we can give one common drug. You can give IV corticosteroids. IV steroids are useful in poisoning cases क्योंकि IV steroids, so basically it is not mandatory, not in all the cases. कई बार जाके मत बोल देना सारे poisoning का antidote है IV steroid, ऐसा नहीं है. सारे poisoning में common step of management में ये commonly include कर सकते हो. So that is your IV steroids, but not all cases. सारे cases में नहीं देते हो. In many cases you can consider why IV steroids. तो आप लोगों को physiology समझनी चाहिए. You need to understand the basic physiology here. What do I mean by basic physiology here, my dear students? You need to know about IV steroids, why we are giving, because if a person is having a drug overdose, क्या हुआ है? Repeat करो everybody, tell with me. Drug overdose. If there is a drug overdose, automatically to bear the stress, so body is under a stressful scenario. So स्ट्रेस को बेयर करने के लिए, टू बेयर द स्ट्रेस, यू आर सपोज टू गिव ए IV steroid. This is a very important point to be remembered, but not all the cases requirement नहीं होता है. Okay, now apart from that, you are going to check for the poison and you are going to start with the antidote, whatever the specific antidote is there for that particular thing, or whatever the specific treatment is there. Okay, so anyways, so let's start off with the first and most important poisoning, that is your anticholinesterases. What is that? Anticholinesterases and your organophosphate poisoning. What is that? Organophosphate poisoning. So before I go into the go into the discussion, just quickly for my satisfaction, give me a comment upon the what is that, which is the antidote for organophosphates. Come on everybody, tell me quickly, बताओ organophosphates का common antidote क्या होता है? All of you by heart, what is that? हाँ, क्या होता है? That will be your atropine. But ऐसा atropine याद करके जाओगे ना, examiner is least interested in giving you directly asking what is the antidote for this poisoning. Examiner is more interested by giving you the clinical feature. He would expect you to diagnose the scenario and he would expect you to answer, right? So that is why we will learn about this these anticholinesterases and organophosphates. So these anticholinesterases and organophosphate, correct Shubham Tiwari, you're absolutely correct. थोड़ा lag आ रहा है शायद, because of that you might be getting a little bit difficulty, that's it. Anyways, तो organophosphates and anticholinesterases, पहले तो यहाँ पे दिया हुआ है, what is that? Organophosphates का एक image दिया हुआ है. So that is the classic example. You have your parathione and melathione. Okay, what do you have? Parathione and melathione. So let's start off with the anticholinesterases and organophosphates. Both of these things, इनका mechanism of action क्या होता है? Clinical features are what? How do we diagnose and how do we pick up? So first let's start off with the mechanism of action. Mechanism of action, the word itself is very clear. Anti नहीं है भैया. What is that? Anticholinesterases. So what do I mean by anticholinesterases? They inhibit the acetylcholine esterase. बच्चों किसको inhibit करेगा? Acetylcholine esterase. They inhibit which enzyme? Acetylcholine esterase. So acetylcholine esterase, what is the function of acetylcholine esterase normally in the body? Normally acetylcholine esterase is responsible for the breakdown of acetylcholine. फिर से बताता हूँ, acetylcholine esterase, what will it do? It breaks the acetylcholine. Okay, if acetylcholine is esterase is blocked, acetylcholine esterase is blocked, now they will ask you, they can ask you, enzyme के अंदर at which site? At a site in the enzyme called as at a esteric site. At which site? Esteric site of this enzyme. So because of that acetylcholinesterase inhibition, there is an increased amount of acetylcholine in the body. Increased amount of acetylcholine in the body. So acetylcholine is a neurotransmitter. In which system they are going to ask? You need to know. So where is the neurotransmitter acetylcholine? Where is the neurotransmitter? Very good. That will be in your, what is that? Parasympathetic nervous system. So acetylcholine increases, that will go and activate parasympathetic nervous system. That will activate which nervous system? parasympathetic nervous. If parasympathetic nervous system is activated, parasympathetic nervous system के अंदर mainly which receptors are there? M cholinereceptors are activated. What are the receptors which are activated? M cholinereceptors are activated. So parasympathetic will activate M receptor. M receptor activate होने के वजह से the clinical features are going to be there. So what are the clinical features? What are the clinical features of these anticholinesterases? Anticholinesterases are organophosphate. दोनों का एक ही mechanism है. But I want you to understand anticholinesterase के लिए drugs, the classic examples are the drugs such as physostigmine. What is a drug? Physostigmine. Okay. So we have other drugs such as neostigmine. Okay. So neostigmine, physostigmine, galantamine, वो सारे drugs आते हैं. वैसे similar mechanism they have is organophosphate. दोनों का poisoning में the common clinical features are going to be these. That is excessive activity of parasympathetic nervous system. So what are the clinical features? Parasympathetic activate होगा तो pupil में क्या होगा? Mydriasis or meiosis. Parasympathetic activation will lead to eye का clinical feature. The clinical feature is going to be meiosis. What is the clinical feature, bachcho? Meiosis. What is the clinical feature? Meiosis. Okay. Then apart from that, what happens to the oral cavity or any secretion? Parasympathetic is known for what? Increase of the secretion. मतलब सलाइवा को बढ़ा देगा, राइट? रेस्पिरेटरी ट्रैक के अंदर सेक्रीशंस को बढ़ा देगा, राइट? जीआईटी के सेक्रीशंस विल बी इंक्रीज्ड. ओके, सो देयर इज अ इंक्रीज ऑफ सेक्रीशंस. Increase of secretions. ये confusion point, a confusing point, that is sweating will be there. That will be which type of sweating? That will be cold sweat, बच्चों. What is that? Cold sweat. Okay. What will be the clinical feature? Cold sweat. Very good, guys. Cold sweat. Why cold sweat? Because in the sweat gland के अंदर भी which receptors होते हैं? Sweat gland also contains M receptor. M receptors are present in the sweat gland also. Because of activation of sweat glands, that will lead to cold sweat. Normally sweating होना चाहिए sympathetic activation. Now listen to me very carefully. Normally sweating increases as a result of activation of sympathetic nervous system. But here why it is occurring? Because more acetylcholine is there. Acetylcholine will activate the M receptors which are exclusively located, like not exclusively, but rather the better term is except case. Okay, so there is one exceptional case. That is exceptional case is sweat gland is controlled by sympathetic, but a neurotransmitter is acetylcholine. That is a exclusive case. Okay, now let's go to the next point. What is that? The person's respiratory rate, decrease of the respiratory rate, decrease of the heart rate because sympathetic activate parasympathetic activate ho gaya. Yes, then the patient will have diarrhea. Yes, okay. So meiosis ho jayega to vision disturbance can be there. Vision disturbance can be there. Okay, so these are some important clinical features of what is that? Of your, yes, that is only your, what is that? Organophosphate poisoning. ये meiosis कहाँ तक जा सकता है पता है? It can go up to pinpoint pupil. What is that? Pinpoint pupil. Okay, so these are few important clinical feature. तो जैसे क्लिनिकल फीचर दिख गया तो व्हाट इज द ट्रीटमेंट? ट्रीटमेंट के अंदर आप लोगों को स्टेप वाइज अप्रोच इंपॉर्टेंट है. व्हाट इज दैट स्टेप वाइज अप्रोच इंपॉर्टेंट? सो द मोस्ट इंपॉर्टेंट थिंग इज दैट इज रिमूव द एक्सपोजर. बच्चों, रिमूव द एक्सपोजर ऑफ योर ऑर्गेनोफॉस्फेट. Okay, why you need to remove the exposure? Why you need to remove the exposure? I will tell you with one example. Okay, now what happens, like organophosphate, it is not always swallowed. It is not always swallowing of organophosphate. Sometimes what happens, farmers जब spray कर रहे होंगे, when they are doing what? Spraying in the field, because of the wind, organophosphate poison falls on the skin. From the skin, organophosphates will get absorbed. This is a very important point. From skin, what can get absorbed? Organophosphate. Remove the exposure because organophosphates can get absorbed from the skin. Can get absorbed from where? From the skin. So that is why you need to remember skin से absorption हो सकता है. What is that? That is why you need to remove the exposure. Patient का clothes remove करके पूरा body को wipe कर देना चाहिए. You have to do that. Remove the clothes of the patient and wipe off the poison if it is there. Okay, that is a very, very important thing. The next point is that you're going to start with a drug. What is that drug? Called as atropine. What is that? Atropine. Okay, so when we are speaking of atropine बच्चों, very important, कितना atropine देना चाहिए, till when you have to give the atropine, that is important. So you need to look for the signs of atropinization. Signs of atropinization. What do I mean by this? Signs of atropinization means the the quantity of atropine you have given, whether it is sufficient or not, till when you are supposed to give the atropine. So यहाँ पे क्या था, pinpoint pupil था. Pinpoint pupil का opposite होना चाहिए. After you give the treatment, it should become opposite to that of pinpoint pupil. That should become mydriasis. That should become what? Mydriasis. Okay, so this is a very important point, bacho. Mydriasis. Why what should happen? Organophosphate poisoning had pinpoint pupil. Now it has to become mydriatic, means dilation of the pupil. That is a very important point. Then the patient had a decrease of heart rate. The patient had what? Bradycardia. The patient should have a tachycardia. Patient should develop what? A tachycardia. Heart rate should increase, till then you are supposed to give. And the next one is decrease of secretion. Secretions क्या हुआ था? बढ़ा हुआ था. That should lead to decrease of the secretion. If you see these three things, okay, if you see these three things, that is telling you that you have given a sufficient amount of atropine. What are the three things you are going to look for? Tell me everybody, what are the three things? Three things. One is look into the eyes, mydriasis. Then listen to the heart. There should be increase of the heart rate, and there should be decrease of secretion. If you find these three signs, तो इसका मतलब है मेरा क्लास तुम लोगों ने अच्छा सुन लिया, that you have given a sufficient amount of atropine for the patient. Good? Understood everybody? Hope everybody understood so far. Now once you understand that, let's go to the next important concept. What is the next important concept? So that is your, so atropine to dete ho. Apart from giving the atropine, my dear students, then we also give what is that? We also give one important this thing. What is that you are going to give? That is your oximes. What you are giving? Oximes. So what are oximes, bache? Oximes are such a type of drugs which are called as enzyme reactivators. Enzyme reactivators. What are those? Enzyme reactivators. So enzyme reactivators, do you have to give in all the cases? No, they are not used for carbamate poisoning. Not used in carbamate poisoning. Okay, so carbamates poisoning हो गया तो क्या नहीं दोगे? What you are not going to give? Oximes. So कौन सी होता है? That is the oximes. What are the oximes we have? We have a drug called as oblidoxime. What is the name of the drug called as? Oblidoxime. We have one more oxime called as pralidoxime. Okay, so oblidoxime and pralidoxime. तो इसके अंदर oximes के बारे में जब भी देखोगे, whenever you are looking at oxime, you are only using it for what is that? You are using it for organophosphate. In that one category you are not using, that is carbamates. That is what? Carbamates. Understood? Okay, sir, इतना करने से sufficient होता है क्या? If I was the examiner, right, I will give all of this in the questions itself. I will give what? All of this in the questions itself. I will give all of it in the question, and I will ask you one simple thing. What is such parameter you are monitoring during the treatment of organophosphate poisoning? What you will monitor during the treatment of organophosphate poisoning? What will you monitor? Everybody tell me. Very good. Oblidoxime and pralidoxime is correct. But मैं examiner होता ना, कोई एक चीज को पैरामीटर को मॉनिटर करते हो, मतलब यू आर गोइंग टू चेक फॉर असीटाइल कोलिन एस्टरेज लेवल इटसेल्फ, मतलब वो एंजाइम का लेवल कोई चेक करोगे आप. What you are checking? Checking for the level of enzyme. So what exactly you are checking is RBC, blood के अंदर RBC, acetyl choline esterase is monitored. So treatment के दौरान, during the treatment, what you are going to do? Monitor RBC, acetyl choline esterase. RBC, acetyl choline esterase. These are the important points of organophosphate poisoning. And your what is that? Anticholinesterases such as physostigmine, neostigmine, and galantamine. All of these things will have a similar characteristic. So these are the clinical feature. This is the important things. Signs of atropinization, very important, can be asked as a MCQ. What is the drug of choice? That is antidote of choice is asked as a MCQ. Previously बहुत बार पूछा गया है already. Then with the next possible question which can be asked is किस चीज को monitor करोगे? तो हार्ट रेट वो तो वाइटल्स तो मॉनिटर करोगे, यू आर गोइंग टू मॉनिटर द वाइटल्स, along with the monitoring of the vitals you are going to check for RBC acetylcholine esterase levels. Okay, let's go to the next one, mushroom poisoning. What is that? Mushroom poisoning. When we are speaking of mushroom poisoning, students have a lot of confusion regarding the mushroom poisoning, and many students will get confused which mushroom is what and what exactly happens. Okay, so don't worry, now listen to me. Mushroom poisoning, mushroom poisoning के अंदर the commonly encountered mushroom poisonings के अंदर दो तरीके का species होते हैं. So one you have here, right? We have a species called as Amanita, right? So this is also a type of Amanita. Now, if both are Amanita mushrooms only, which type of Amanita you need to remember? So this colorful mushroom, what you are seeing, bacho, colorful mushroom, what you are seeing, this is only called as Amanita. What is the name of the Amanita? Amanita phalloides. Amanita phalloides. Then what mushroom you are seeing here, bacho? This one you are going to call it as Amanita muscaria. What is that? Amanita muscaria. तो अमेनिटा फाइलॉइड्स एंड अमेनिटा मस्कैरिया के बारे में सोचने के लिए सो मशरूम पॉइजनिंग के अंदर सो फर्स्ट एंड मोस्ट इंपॉर्टेंट अमेनिटा मस्कैरिया कंटेन्स अ केमिकल. द नेम ऑफ द केमिकल इज कॉल्ड एज मस्करिन. The name of the chemical is called as muscarin. What is the name of the chemical called as muscarin? Now this muscarin, whatever present in the Amanita muscaria mushroom, this muscarin will go and activate a M cholinereceptor. Which receptors are getting activated? M cholinereceptors are getting. So because of the activation of the M cholinereceptor, what are the clinical feature? So clinical feature, the first point you need to remember is a very quick onset. That means it will show the onset, early onset. Okay, so इसीलिए इसी poisoning को, this poisoning is only called as early mushroom poisoning. Which early mushroom poisoning is caused by which mushroom? कौन सी mushroom causes early mushroom poisoning? Amanita muscaria. Okay, Amanita muscaria. Okay, it's not Sonerita, it's Amanita muscaria. Okay, now there is early onset. So because of the activation of the M receptor, that means what happens to the eye? Parasympathetic system has been activated. M receptors are working with which nervous system? Parasympathetic. So parasympathetic activate हो जाएगा तो eye के अंदर क्या होगा? हाँ बच्चों बताओ अभी. Tell me what happens? What happens? Meiosis or mydriasis? Of course, that lead to meiosis. Excessive activation of M cholinereceptor that will lead to increase of the secretions. Increase of the secretion, decrease of the heart rate, because which system has been activated? Parasympathetic is activated. Okay, so decrease of heart rate, and along with that, what else you can find, my dear students? There is a decrease of respiratory rate. Okay, now along with that, one important thing which you need to remember is clinical features are almost similar to that of organophosphate poisoning. Almost similar to that of organophosphate poisoning. Okay, decrease of respiratory rate, agreed. Along with the decrease of the respiratory rate, the patient can have the increase of secretion and difficulty in breathing. Difficulty in breathing, which is same as that of, what is that? Same as that of, yes, of course, your organophosphate poisoning. So now you need to think about this. कौन से receptors activate हुआ? Which receptors are activated? M receptor. So the antidote is going to be what? Treatment is going to be what? The activated receptor is M receptor. If M receptor is activated, what is the treatment you are supposed to give? Of course, M receptor blocker. M receptor blocker. So which is that M receptor blocker which can block M1, M2, M3? मतलब सारे types of M receptors can be blocked by this particular drug. Which is the drug? Welcome to the magic. What is that magic? Yes, magical and very, very powerful M cholinereceptor blocker is which one? Of course, that will be your Atropine, bacho. What is the drug of choice for mushroom poisoning? Atropine. What is the drug of choice for mushroom poisoning? Atropine. So that is why you need to remember early mushroom poisoning occurs as a result of Amanita muscaria. Who is this Amanita muscaria? This is the mushroom right here. So this is the Amanita muscaria mushroom. Now Amanita species can have a chemical. The name of the chemical is muscarin. So that muscarine will cause activation of M receptor. Because of that early onset, immediately दिखने लगेगा. Okay, so that is why we will have this word particular Amanita muscaria poisoning. Okay, all right. तो अमेनिटा फेलॉइड्स का कहानी क्या है? अमेनिटा फेलॉइड्स का कहानी इज वेरी इंटरेस्टिंग टू अंडरस्टैंड बच्चों. अमेनिटा फेलॉइड्स, द मैकेनिज्म ऑफ एक्शन, it act by inhibition of an enzyme called as RNA polymerase. It will inhibit an enzyme called as RNA polymerase. RNA polymerase कम होगा तो that will lead to decrease of mRNA formation. क्या बनना कम होता है? mRNA formation will be reduced. mRNA formation reduce हो जाएगा. mRNA is the what type of RNA? Messenger RNA. So we don't have a messenger RNA formation. If messenger RNA formation will be decreased, so that will lead to decrease of protein synthesis. So if there is a decrease of protein synthesis, because of that, it will lead to late clinical feature. Why? Because proteins तो body के अंदर है. Now, ये proteins के बाद after 10 hours, 12 hours, 13 hours, 14 hours, slowly your body will start to have a deficiency of proteins because of what? RNA polymerase blockade. So that will create which type of clinical feature? Early or late? The late symptoms. So that is why Amanita phalloides mushroom will give a which type of poisoning? Late mushroom poisoning. Late mushroom poisoning के अंदर what is the treatment? So सबको होता है. We used to remember one thing. Always we used to remember it as mushroom आ गया तो आंसर क्या होगा? Always we used to think atropine. No, if it is a late mushroom poisoning, no atropine. Okay, remember there is no atropine here. Only and only symptomatic treatment. Only symptomatic treatment. Okay, but what our students does as a mistake ये करते हैं when you are studying, the mistake is going to be like, you people will start to think like, early में क्या होगा, late में क्या होगा. कुछ नहीं, ये पूरा concept समझ लेना. What is the concept? अर्ली मशरूम दोनों कॉस्ट पे सेम स्पीशीज, अमेनिटा स्पीशीज, बट उसके अंदर दो वेरिएंट्स है. वन इज फैलॉइड्स वेरिएंट, वन इज मस्कारिया वेरिएंट. दैट मस्कारिया वेरिएंट कंसिस्ट ऑफ मस्कारिन. दैट्स व्हाई इट विल क्रिएट अ अर्ली पॉइजनिंग. मतलब the person who does swallowed the mushroom, immediately muscarine will go and block the M receptor. That's why we are getting early symptom. Okay, but here person who does swallowed this one, it has to go slowly inhibit the enzyme inhibit करने के बाद mRNA कम होना चाहिए. mRNA कम होने के बाद protein synthesis कम होगा. Because of that, the clinical feature appears to be late. So that is why we'll call it as a late mushroom poisoning. Hope these points are clear, बच्चों. Hope these points are clear. Let's go to the next one, that is atropine, datura and belladonna. So I have given them a mnemonic called as bad. Okay, if they are bad, we have planned for that. If you are bad, I am your dad. Like that, we'll bring out the antidote. Don't worry. Okay. So now atropine actually is a plant source drug. Atropine क्या आता है? Plant origin drug. So plant origin drug. So कौन सी plant से आता है? Mainly which plant? It comes from the belladonna plant. Okay. But दोनों के अंदर, this one is your datura. This is your datura. So you can see this one, and you can see the fruit, that is thorn apple, right? So this one you have here you have is your belladonna. Okay, so belladonna and datura, both of them commonly active compound is what? ये point दिखना चाहिए. This is a very, very important point. The active compound in both of them. If there are any comments, let me check once. So active compound is atropine only. Active compound is what? Atropine only. Okay. So if active compound is atropine only, one second. If active compound is atropine only, automatically what happens, bacho? Active compound is atropine. So atropine, if it is an active compound, so all the clinical features are going to be that of, yes, exactly, atropine ka overdose. So what are the clinical features? So atropine. So now what will happen is that atropine ka mechanism seekhna chahiye. Atropine will go and block M receptors. Which receptor? M cholinereceptors are being blocked. Right? If M cholinereceptors are being blocked, bache, that will lead to what is that? That will lead to blockade of the parasympathetic nervous system. So if there is a blockade of the parasympathetic nervous system, what are the clinical features we are going to see? So parasympathetic activate hota to meiosis. If parasympathetic is blocked, mydriasis. What will occur? Mydriasis. So in the eye, there will be mydriasis. Okay. Apart from that, what else will be the clinical feature? In the oral cavity, if parasympathetic is activated, secretion and salivations will be increased. But instead of that, now what happened is, what is that? Secretions will be reduced. So that will lead to dry mouth. That will lead to dry mouth. Then apart from that, there is a decrease of secretions in the other places also, like in your respiratory tract. Okay. Then the patient will have diarrhea or constipation. Parasympathetic activate hota hai to diarrhea. Diarrhea would be a clinical feature of what? Clinical feature of organophosphate or mushroom poisoning. Here the patient will have constipation. Okay, the patient will have increase of heart rate, the patient will have increase of respiratory rate. Okay, and also brain can, the patient can have confusion. Okay, confusion. Okay, now the patient what will become is mydriasis. Matlab pupil has been dilated. If pupil is dilated, more light will fall on the retina, so person will become very sensitive to light. Person will become sensitive to light. Sensitive to light. Okay, so these are the clinical features which can be associated as a result of what? As a result of your atropine, datura and belladonna. Okay, these were bad, so iska treatment kya hoga? So if they are bad, if I'm bad, like what is the dialogue? If you are bad, I am your dad. तो इसका dad कौन होगा? मतलब इसका antidote क्या होगा? The treatment of choice for these ones is, the drug of choice is your physostigmine. What is the drug of choice? Physostigmine. Physostigmine ही क्यों देना चाहिए? Why do we give physostigmine only, बच्चों? Why do we give physostigmine only? Because remember, because atropine has the ability. What is the ability? Atropine can cross the blood-brain barrier. Atropine can cross the blood-brain barrier. Okay, so that is why we need to use a drug, physostigmine. Physostigmine also cross the blood-brain barrier. इसीलिए इसी ड्रग को select करते हो. Which drug is selected? Physostigmine itself is selected because atropine also crosses the blood-brain barrier. When we are giving the antidote, our antidote also must cross the blood-brain barrier. Hope everybody able to understand. Please let me know. मजा आ रहा है? These ये सारे ना क्या करते हैं पता है? Many students what will they do is that diarrhea, dryness. अब किसका dryness है, कौन सी चीज का diarrhea है, you will get confused. That's why you should not be confused. You need to have a clear idea what is the compound. The compound may be coming from the datura, may be coming from the belladonna, but both of them have active principle is what? Atropine. तो atropine if it is there, atropine का mechanism of action क्या है? M receptor blocker है ना. So these are the clinical feature. Now we are giving physostigmine. अगर मैं examiner होता ना, मैं बोल देता ये patient was diagnosed case of belladonna overdose. Doctor decided to give him an antidote physostigmine. Which of the following properly explain the role of physostigmine? Physostigmine का role क्या होता है? Mechanism of action. It will inhibit the acetylcholine esterase. That will lead to increase of acetylcholine. Acetylcholine बढ़ेगा तो automatically it will kick the atropine from the receptor. Atropine को भगा देगा, हट निकल तू. क्यों? क्योंकि acetylcholine quantity is more. Now automatically acetylcholine will come and tell, hey चल पहली फुर्सत में निकल, atropine को बोले. जैसे निकल जाएगा, M receptor will become reactivate. So the symptoms will be clarified. Okay, so it is acetylcholine esterase inhibitor. And why we are choosing among this group? Why we are preferably choosing this drug only? Because physostigmine is a longer acting drug and more importantly crosses the blood-brain barrier. That's it. Let's go to the next one. What is that? Heparin. What is that? Heparin. तो हेपेरिन के बारे में क्विकली फ्यू इंपॉर्टेंट की पॉइंट्स नोटिस कर लेते हैं. ओके, सो व्हाट इज हेपेरिन? सो माय डियर स्टूडेंट्स, हेपेरिन माय डियर स्टूडेंट्स इज a type of glycosaminoglycan. Is a type of, what is that? Glycosaminoglycan. It is a type of glycosaminoglycan which is produced in the human body itself. In the body produced by in the body, in the glycosaminoglycan in the body, produced by which cells? That's a very important. Produced by mast cells. Okay, mast cells. But what is the use as a drug? As a drug, when do we use it? As a drug, used as a anticoagulant. Used as what? Anticoagulant. Anticoagulant. Okay, so heparin is used as what? Anticoagulant. अगर हेपारिन का डोज ज्यादा हो जाएगा, if that all there is a overdose of the heparin, so what are the clinical features of overdose? So clinical feature of overdose, ऐसा कोई specific clinical feature नहीं होगा. Increase bleeding tendency, ये एक की major life threatening scenario. It increases the bleeding tendency. Okay, so increase the bleeding tendency. Increase the bleeding tendency. Is it only externally? No, internally can also bleeding can occur. मतलब मान के चलो patient को heparin overdose हो गया. Now if we add a ulcer से bleed होने के possibilities are very high. Ulcer से bleed होने के possibilities are very high if he is having a overdose of heparin and a peptic ulcer. Okay, for example, heparin overdose time, he was fine, everything was well and good. A patient had a small injury that will lead to massive bleed. Small injury also can lead to little massive bleed, so increased tendency of bleeding, and even INR भी change हो सकता है, but as such main thing is increased tendency of bleeding. Okay, now what is the antidote? What is the antidote? The antidote, my dear students, the drug is a protamine sulfate. What is the drug we are going to use? Protamine sulfate. What is the drug we are going to use? Protamine sulfate. Protamine sulfate comes from where? कहाँ से आता है? It is found in the salmon fish. Which fish? Salmon fish. Salmon fish का कहाँ से आता है? Sperm से आता है. Salmon fish का कहाँ से आता है? Sperm से आता है. Here I have put a image of salmon fish. You can notice. Normally salmon fish is which type of fish? A freshwater fish होता है or sea fish होता है. Normally it is a freshwater fish. मतलब river से ये बनता है. मतलब it takes birth in the freshwater. Later in its life it will end up into the oceans. Okay, it is a freshwater fish. Birth will occur in the freshwater only, but it will end up into the oceans. Okay, so it is usually considered to be freshwater. So what is the drug? Protamine. But if I am an examiner, I would ask you, protamine heparin में कैसा काम करता है? How does protamine works in the heparin overdose? Now I want you to understand one curious important thing. Protamine, my dear students, it is a very strong. It is very strong alkaline substance. Alkaline are a basic substance. Is a very basic substance. Okay, so now heparin का nature को भी देख लेते हैं. Heparin is what? Heparin actually is a highly acidic in nature. Heparin is what? Highly acidic in nature. So heparin is highly acidic in nature. Now alkaline is doing what? Neutralizing the heparin. So protamine and heparin. Protamine and heparin. ये दोनों कैसा काम करते हैं? They are working by neutralization. Neutralization is which type of reaction? A type of chemical reaction. So automatically what you need to remember, my dear student, protamine and heparin is a classic example for chemical antagonism. Which antagonism? Chemical antagonism. ओके, कंफ्यूज नहीं होना चाहिए. विच टाइप ऑफ एंटागोनिज्म बच्चों? केमिकल एंटागोनिज्म. ओके, बस हम लोग क्या कर देते हैं? रट लिया. प्रोटामाइन हेपेरिन, हेपेरिन प्रोटामाइन. क्यों? कैसा? किसी को मतलब ज्यादा हम देखे ही नहीं. ओके, एग्जामिनर क्या करेगा पता है? डॉक्टर was giving it treatment with heparin. Suddenly patient found to have a symptoms of overdose of heparin. He was treated with what? Protamine sulfate. This is a classic example for which of the following? Physical antagonism, receptor antagonism, biological antagonism, chemical antagonism. हाँ, सीधा आंसर मार्क करो मेरा स्टूडेंट. सब लोग कोई गलत नहीं करेगा. क्या मार्क करोगे? Chemical antagonism. What will you mark, my dear students? Chemical antagonism. Why? Because protamine is a alkaline substance, heparin is a acidic substance. Understood? అర్థమైందా? సమझ में आया? పని అర్థనా? పురింజిదా? అర్థ అయితా? అర్థమైందా? Okay, so that is how you need to understand these things. Okay, let's go to the next one. What is that? Warfarin. What is that? Warfarin. तो पहले warfarin को देखते हैं. Warfarin कहाँ से आता है? ये केमिकल क्या है? और what is the antidote? What is the treatment? Okay, how it will, what is the history also देख लेते हैं. ठीक है, तो warfarin actually it comes from a coumadin derivatives. It is a coumadin derivative. It is a type of which derivative? Coumadin derivative. It is a type of chemical derivative. कहाँ से आता है? coumadin जैसा chemical से आता है. ये coumadin actually naturally existing substance. It's a naturally existing substance. उससे आता है. From there you are getting what is that? Warfarin. ठीक है? Warfarin first actually earlier used as what? Earlier used as what, you know? Rat poison. Sir, क्या क्या बता रहे हो आप? Yes, it was used as a rat poison only. It was used as a rat poison. जैसे rats used to take this warfarin खाने के बाद rats के अंदर internally bleed हो जाता. Internally what was occurring? Bleeding was occurring. What was occurring? Bleeding was occurring. So internal bleeding होने की वजह से these coumadins were used as a rat poison. So internally bleeding. So because of that internal bleeding, the scientists started to develop. It can be मतलब blood बहुत thin हो गया. So because of that, blood has become very thin. Because of that, it led to the bleeding and death of the rat. So that logic made to believe and research and develop the warfarin as a anticoagulant. Warfarin as a anticoagulant. So warfarin is used as what? Anticoagulant. अब पूरा warfarin तो पढ़ाऊंगा नहीं मैं, just history for your curiosity. ठीक है, and our poison or overdose treatment के बारे में देखिए. It's used as an anticoagulant. You know what is the history of the warfarin का? History of the name के पीछे भी एक history है. Okay, what do I mean by this? What is that? Wisconsin alumni research foundation. So there was one this thing, foundation, Wisconsin alumni research foundation. Okay, research foundation. ठीक है, तो this will become WARF, WARF. Okay, coumadin which is also earlier can be known as coumarin, which can also be called as coumarin say Rinelia. Okay, so what is that? Rin, and it became a warfarin. Okay, what is that? Warfarin. So coumarin say Arinlia. Okay, and WARF is responsible for what? Wisconsin Alumni Research Foundation. वैसा नाम दिया गया है इसको. क्या दिया गया है? What is the name given to this? Warfarin. It is an anticoagulant. Okay, so what is the overdose होगा? तो overdose कब होगा? Overdose occurs as a result of what? As a result of sometimes miscalculation, sometimes wrong dosage, sometimes because of the drug interaction. But sometimes because of what? Drug interaction. So during the overdose, what is the treatment which you need to remember? So if overdose occurs, clinical features क्या होता है? Clinical features, my dear students, there is an increased bleeding tendency. Increase of bleeding tendency, right? But most importantly, you can also find increase of INR. Increase of what? INR. INR means what? Indian Rupiah. So Indian Rupiah outside of medical science. But as such, when we are speaking of INR in the medical field, what is the meaning is very simple. That is your international normalized ratio. What is that? International normalized ratio. That international normalized ratio, so basically is monitored during a warfarin usage. Warfarin usage में क्या monitor करते हो? INR monitor करते हो. Warfarin does not have a TDM, but so this is also one more extra point for you people. लिख लेना, write it down and keep. Warfarin, we are doing what is that? INR को check करते हो. INR is not a therapeutic drug monitoring. INR therapeutic drug monitoring नहीं है. INR is not a therapeutic drug monitoring. It is just a parameter monitoring. It is not a TDM, not a TDM. बहुत बार बोल चुका हूँ. ये 2-3 times this question has come and many students have made the mistake. INR is not a TDM, not a TDM. Okay, so there is an increase of bleeding tendency and increase of INR. So what will be the antidote? The treatment will be, what will be the treatment? Overdose clinical feature तो पढ़ लिए. The treatment, my dear students, is your vitamin K. What is that? Vitamin K. If there is a, so these are interchangeably used antidotes. Vitamin K overdose के लिए warfarin. Vitamin K overdose के लिए what is that? Warfarin. Okay. Warfarin का overdose के लिए what is the drug of choice? vitamin K. What is that? Vitamin K. So warfarin mainly inhibit an enzyme called as warfarin का mechanism of action of warfarin. ये भी एक बार refresh हो जाएगा. So just go through this also. So mechanism of action of warfarin. It inhibits an enzyme. The name of the enzyme is called as vitamin K epoxidoreductase. What is the name of the enzyme? Vitamin K epoxidoreductase. What is the name of the enzyme? Repeat everybody. वहीं बैठ के repeat करो. What is the name of the enzyme? Epoxidoreductase. So if there is the inhibition of this epoxidoreductase, because of that there is a decrease of factor number. I will write in a normal numbers only. 2, 7, 9, 10. What are the factors? 2, 7, 9, 10 factors. ओके सो कौन सी फैक्टर्स कम हो जाएगा 2 7 9 10 फैक्टर्स कम हो जाएगा अगर फैक्टर नहीं है तो ऑटोमेटिकली इट विल वर्क एज एंटी कोआगुलेंट ठीक है नाउ सर विटामिन के क्यों देना चाहिए बच्चों देखो विटामिन के इज रिक्वायर्ड फॉर व्हाट विटामिन के रिक्वायर्ड फॉर यस रिक्वायर्ड for 2 7 9 10 production factor number 2 7 9 10 production के लिए कौन चाहिए vitamin K which is needed vitamin K and that production will be blocked by which substance production will be blocked by your warfarin बच्चों production will be blocked by your warfarin so that is the story of your warfarin overdose vitamin K's role in the warfarin poisoning and other important aspects related to this particular drug overdose. All right, hope I'm clear. शायद सबको I'm hoping that everybody is able to understand. I'll continue to the next one that is your fibrinolytics. Okay, fibrinolytics के लिए आप लोग क्योंकि इसके अंदर क्लिनिकल फीचर्स से ज्यादा ऑटोमेटिकली ये बहुत इमरजेंसीज में होता है and it can lead to directly it can lead to bleeding itself. Okay, it will cause the hemorrhage. Fibrinolytics कौन सी होता है पहले वो बता देता हूँ. Fibrinolytics, what is that? Fibrinolytics such as your streptokinase. Name of the drug is what? Streptokinase. Okay, what is the name of the drug? Streptokinase. And other drugs such as your TPS, tissue plasminogen activator. What is this tissue plasminogen activator? Such as alteplase. You have your TNK. What is TNK stands for? Tenecteplase. What is that? Tenecteplase. In that there is no K. TNK stands for tenecteplase, but when you spell the full drug, there is no K, that is C, tenecteplase. Okay, then you have your retiplase. So these are the drugs you have, retiplase, alteplase. Okay, so इसके अंदर clinical feature, what are the clinical feature? ये क्या करेगा? Clots को break करेगा, clots break करेगा, and previously there was small clot in the brain, clot break हो गया, तो automatically it will lead to bleeding and hemorrhages. It will lead to hemorrhages. Okay, so what is that? Hemorrhages. Okay, so if there is a hemorrhages, what is the antidote? इतना याद रखो आप लोग, antidote कौन सी होगी and ये drugs का overdose होगी तो करना क्या चाहिए? You can use something called as aminocaproic acid. You can use something called as aminocaproic acid, or you can also consider tranexamic acid. Aminocaproic acid or tranexamic acid. Okay, so that is the story of your, what is that? A story of your fibrinolytics overdose. Let's go to the most important and star mark question. Many times there is a question which have been asked related to this. Okay, digoxin overdose में अंदर what are the clinical features we are going to get, what are the antidotes we are supposed to give, how we are supposed to manage. Let me teach you people about everything. Okay, so first and most important, digoxin comes from a plant. The name of the plant I have given here, the name of the plant is only called as digitalis plant. Digitalis plant are also called as digitalis purpurea. वो purpura नहीं है, purpurea. So what is that? Purpurea digitalis plant. Okay, so a digitalis plant are also called as foxglove. Also called as which glove? Foxglove plant. ठीक है. So now when we are speaking of foxglove plant, so इसका overdose का clinical features क्या होता है and what and all important these things and confusions, let's see. Okay, first and most importantly ये digoxin को use करते हो used in chronic heart failure, used in chronic heart failure. So now if there is a toxicity कब toxicity होगा? Toxicity precipitated by, okay, precipitated by. Okay, what do I mean by precipitated by? Basically, toxicity hoga. That toxicity will become even more severe in this condition. In which condition digoxin toxicity becomes even more severe? One of the most important condition is your hypokalemia. Hypokalemia, less amount of potassium in the blood will precipitate or enhance or causes more severity of the digoxin toxicity. And also during hypercalcemia. Hypercalcemia. So hypercalcemia and hypokalemia, these are the two important conditions where digitalis toxicity will become even more severe. Okay, if there is a severe digitalis toxicity, now we need to understand what are the clinical features. Okay, so clinical features, very important ones. Most importantly, so you need to remember the patient will have muscle weakness. What is the clinical feature will be there? Muscle weakness will be there. Why muscle weakness? Because digitalis किसके साथ पैर में होता है पता है? Digoxin is in love with your skeletal muscle. It loves to bind with the skeletal muscle. Body के अंदर if you give digoxin, body के अंदर digoxin will go more towards the skeletal muscle. So weakness will become very prominent. Then the patient can also have vomiting, abdominal pain. Okay, abdominal pain. The patient can have your favorite clinical feature, nausea and vomiting can be present, abdominal pain can be present, but the most important factors, it can lead to arrhythmia. It can lead to arrhythmias. Okay, what are the types of arrhythmia? It can lead to decrease of heart rate. That is one possibility. Why it will decrease the heart rate? Because digoxin is a type of vagomimetic drug. कौन सी drug होता है? Vagomimetic drug. Okay, means it will stimulate your vagus nerve. It will stimulate which nerve? Vagus nerve. So it is a digoxin is a vagomimetic drug. Which mimetic? Vagomimetic drug. Okay, now and also it can lead to most important that is ventricular arrhythmia. So ventricular arrhythmia such as ventricular flutter, ventricular fibrillation are possible, and these arrhythmias are very dangerous. And more importantly, bacho, the person can also have, this is a very unique feature, that is your yellow halos. What is that? Yellow halos. Patient will tell as if he is having a star or some yellow color light around him. Patient will feel that there is some which color light? Yellow color light which is present around him. Such type of feeling can be possibly present. So that can be seen with your digitalis toxicity only, precipitated by hypokalemia and hypercalcemia. And the drug is used in congestive cardiac failure. एक last point बता ही देता हूँ, mechanism of action. It will inhibit sodium पोटेशियम एटीपीएस. हो गया ऑलमोस्ट डिजॉक्सिन के बारे में एवरीथिंग इज डन. सोडियम पोटेशियम एटीपीएस इनहिबिटर कंजेस्टिव कार्डियक फेलियर में यूज आता है. वेयर देयर इज अ सीवियर कंजेस्टिव कार्डियक फेलियर, इट कम्स फ्रॉम अ प्लांट कॉल्ड एज डिजिटालिस प्लांट. द क्लिनिकल फीचर्स एंड अरिथमियास. ओके, द ट्रीटमेंट के अंदर बहुत लोग कंफ्यूज हो जाते हैं. सो आई वांट यू टू अंडरस्टैंड दिस व्हाट इज द डिजॉक्सिन के बारे में. सो प्लीज अंडरस्टैंड वेरी इंपॉर्टेंटली द एंटीडोट ऑफ चॉइस. एंटीडोट ऑफ चॉइस सब लोग बोलते हो डिजीबाइंड. अगर एग्जामिनर क्या करता है पता है, एक डिजीबाइंड नाम ही नहीं देगा. He will not give the name of the digibind only. So that time it will become a problem for you. So you need to know the full name of the antidote. What is the name of the antidote? That is only called as digoxin immune F antibodies. ये पूरा नाम याद करके जाना, ठीक है. एग्जामिनर विल गिव यू समटाइम्स. व्हाई? व्हाट इज द एंटीडोट? डिगॉक्सिन इम्यून एफ एंटीबॉडीज. ओके, व्हाट इज इसी को आप लोग शॉर्ट फॉर्म में डिजीबाइंड बोलते हो. सो डिजीबाइंड से बेहतर क्या है? डिगॉक्सिन इम्यून एफ एंटीबॉडीज. डिगॉक्सिन इम्यून एफ एंटीबॉडीज. डिगॉक्सिन इम्यून एफ एंटीबॉडीज. अगर वेंट्रिकुलर अरिथमिया by digoxin होगा तो ventricular arrhythmia by digoxin if it is there, then the scenario is different. Ventricular arrhythmia caused by digoxin during that time, बच्चों, what will happen? happen? Please listen to me. Ventricular arrhythmia caused by digoxin. During that time, the drug of choice is lidocaine. Okay. So ऑप्शन के अंदर ध्यान से देखना चाहिए. व्हाट इज द एंटीडोट ओवरऑल पूछेगा तो डिजॉक्सिन इम्यून एफ एंटीबॉडीज. ये पहले भी हुआ है. ही विल नॉट गिव यू द नेम डिजिबाइन. इफ ही डजंट गिव यू द नेम डिजिबाइन, इट डजंट मीन यू विल डायरेक्टली शिफ्ट टू लिडोcaine. Lidocaine is used only and only during the digoxin toxicity. If which arrhythmia develops? Ventricular arrhythmia. If ventricular arrhythmia caused by which one? Digoxin, then the drug of choice is lidocaine for the treatment of arrhythmia. Confuse nahi hona chahiye. So antidote is digoxin immune F antibodies. Other treatment we can also go for dialysis also in this patient. Dialysis also can be useful. All right. So this is a story of your, what is that? Story of your digoxin toxicity. So lithium के बारे में आते हैं. Lithium के बारे में quickly let me explain you people what is the role of where do we use the lithium and what will be the treatment for its overdose. Okay. So lithium, my dear students, is used in mania phase of bipolar disorder. Used in where? Mania phase of bipolar disorder. Other uses such as only mania के अंदर भी use कर सकते हो and bipolar disorder also you can use the lithium. What is lithium? Lithium is a lithium directly lithium ion नहीं देते हो. बैटरी से खोल के lithium नहीं देते हो. Not give the lithium from the battery. Rather it is given in the form of lithium carbonate, or we give it in the form of lithium citrate. ठीक है, lithium citrate. Okay, so if there is a lithium carbonate or lithium citrate, now actually lithium is what type of metal? It's a type of heavy metal. Okay, if at all during the usage, if there is a toxicity develops, so lithium के अंदर TDM भी check करोगे. TDM is checked in the lithium. मतलब you are going to take the blood sample and check for the quantity of lithium in the blood. Blood के अंदर कितना lithium है, that measurement you are going to do, that is only called as measurement of the lithium levels in the blood vessel, called as TDM. Digoxin also will have a TDM. Okay, digoxin will also have a TDM. Phenytoin requires a TDM. Okay, now lithium, if there is a overdose, the treatment for the lithium overdose usually is your dialysis only. What is the treatment? Dialysis only. That is, treatment will be dialysis only. Hope everybody is able to understand. Yes, lithium, you're absolutely correct, Sanchit. It is a drug of choice for mania and mania phase of bipolar disorder. All right. So once we understood about the lithium, let's go to the next important one. What is that? That is weak acid and weak base. Daske kahani. Okay, weak acid. First, let's learn about the weak acids. Weak acids. Okay, so weak acids के लिए examples देखते हैं. Examples is your barbiturates, and next important is your aspirin. The commonly weak acids जो poisoning में हो सकता है, they are your, what is that? Barbiturates and aspirin. Okay, so what is the treatment in this case? In this case, weak acids के लिए what you are going to use is forced alkaline diuresis. Okay, forced alkaline diuresis. So alkaline diuresis मतलब you are changing the urine pH. What is that? Changing the urine pH. Now please listen to me. Normally, I am talking about normal scenario. In a physiological scenario, urine pH. I'm sorry, urine pH. One second, let me have some water. Okay. So, in a normal scenario, urine pH is acidic in nature. Is what in nature? Acidic in nature. Normal scenario, what is urine pH? Acidic in nature. So, into this, if acidic drug comes inside, acidic drug, the drug is acidic and pH is acidic. So that time in a acidic drug in a acidic urine, क्या हो जाएगा? Drug will it go out of the body? So remember, surrounding pH and drug pH, if they have similar nature, मतलब drug भी acidic है, drug is also acidic and surrounding pH is also acidic, मतलब urine भी acidic है. Okay, patient has a poisoning and urine के अंदर कौन गया? Acidic drug गया, तो the drug will undergo reabsorption. reabsorption of the drug matlab. So please listen to me. Somebody had a overdose of aspirin. After taking the aspirin, after 5 or 6 hours, patient was brought to the hospital. When patient was brought to the hospital, maybe 5-6 hours later, aspirin from the GIT would have been absorbed. So now aspirin is present in the blood. Now what I will give? I will give a diuretic. Diuretic होगा तो urination frequency क्या हो जाएगा? बढ़ जाएगा. So if urination increases by the diuretic, automatically from the blood drug has to go into the urine. Urine के अंदर when drug comes and acidic urine is there and acidic drug is there, the drug will go back into the blood. Means it will not go into the urine. Rather pH being same, drug will come back into the blood vessel. So that is why if alkaline urine, if I alkalize the urine, automatically urine is alkaline, so acidic drug will not be reabsorbed. Acidic drug not reabsorb. Okay, so if it will not reabsorb, it means it will go out into the urine. So that is how we are treating forced alkaline diuresis. The drug of the alkalization of the urine is done by your, most importantly, your NaHCO3, that is NaHCO3, that is your sodium bicarbonate. Okay, so forced alkaline diuresis के अंदर diuretic used is diuretics used are your loop diuretics. What is that? Loop diuretics. Okay, then next one, alkalization is done by what? Alkalization is done by your sodium bicarbonate. What is that? Sodium bicarbonate. So why you are doing the alkalization? Because the drug will not get reabsorbed. Means we want to prevent the tubular reabsorption of the drug. Why alkalization of the urine is done? To prevent the tubular reabsorption of the drug. This is very important. Okay, why alkalization? To prevent, to do what? To prevent the tubular reabsorption. A बहुत important point है tubular reabsorption. To prevent the tubular reabsorption, we are doing a alkalization of the urine. This is a very important point. Okay, all right, the same concept exactly opposite apply कर देते हैं. Exactly for the weak bases, when there is no antidote and the drug is weak basis, तो weak acidics के लिए क्या कहते हैं? Alkaline diuresis. ओके, यहाँ पे क्या करोगे? Acidic diuresis. So बस acidic करने के लिए यूरिन को acidic में चेंज कर दो. ड्रग तो बेसिक है, ड्रग इज बेसिक. यूरिन को ज्यादा acidic, make the urine more acidic, automatically drug will not get reabsorbed. There the drug was acidic, make the urine more alkaline. So acidic urine, acidic diuresis. So what is the drug we are going to use? Usually used is ascorbic acid, that is your vitamin C. Vitamin C can be used to increase the decrease the pH of the urine, which is basically make the urine more acidic. All right. Okay, let's go to the next one. Opioid and alcohol, difference and treatment. Difference and its treatment. Okay, opioid अलग है, alcohol अलग है बेटा. ये confuse मत हो ना, बहुत लोग confuse हो जाते हो. And this is a very commonly asked question. I don't want to any of you to make any mistakes here, my dear student. Opioid and alcohol के differences देख लेते हैं and its treatment. Okay, now when we are speaking of opioids, okay, so सॉरी यहाँ पे एक आई मिसिंग है. ओपियोइड्स. ओके, ओपियोइड्स ओवरडोज के अंदर क्या होता है? ओपियोइड्स के अंदर द एग्जांपल्स यू हैव आर योर हेरोइन, राइट? हेरोइन इज अ बैंड ड्रग. You have your morphine, you have your fentanyl. Okay, so all these drugs are your what type of drugs? They stimulate the opioid receptor. They are the agonist of the opioid receptor. Agonist of the opioid receptor. Agonist of which receptor? Opioid receptor. It is agonist of which receptor? Opioid receptor. If it's agonist of the opioid receptor, my dear students, now I want you to look and understand. So basically, what are the clinical feature of overdose? अगर overdose हो जाएगा तो क्या होगा? So if opioid receptors are excessively activated, opioids also will cause mydriasis or meiosis. Remember, they will also cause pinpoint pupil. pinpoint pupil. Okay, they will also cause what is that? Pinpoint pupil. Due to what effect, my dear students? Meiotic effect of the opioid. Meiotic effect of the opioid will lead to what? Pinpoint pupil. Okay, pinpoint pupil. Right. So if the opioids are taken, automatically opioids majorly suppress the which centers of the brain. So they suppress the cuff centers, and also, my dear students, they suppress the respiratory center, leading to decrease of the respiratory rate. Okay, so the third important clinical feature is patient is opioid induced coma. Patient can go into what? Opioid induced coma. Maybe accidental overdose, maybe purposeful overdose. In both of them, pinpoint pupil, decrease of respiratory rate, and coma are the common clinical feature associated with opioid overdose. So what will be the antidote, बच्चों? What will be the एंटीडोट? तो बहुत लोग कंफ्यूज हो जाते हैं. वो द एंटीडोट फॉर द इमीडिएट सिचुएशन, माय डियर स्टूडेंट्स, इज IV. Which drug you are going to give? That is a very important point. You need to remember. IV, you are going to give naloxone. What is the name of the drug you are going to give, बच्चों? Naloxone. Which is what? mechanism भी पता होना चाहिए. It is यहाँ पे opioids कहते हैं. What were opioids, बच्चों? What were opioids? Opioid agonist. What were opioids? Opioid agonist. Naloxone is what? Opioid receptor antagonist. Opioid receptor antagonist. Opioid receptor antagonist. Clear, everybody? Understood? So what is the drug? That is naloxone. Opioid receptor antagonist is the antidote of choice for what? Antidote of choice for your opioid overdose. Then when we are speaking of alcohol, alcohol के अंदर why मैं यहाँ पे याद किया? Many student keep on telling me alcohol में we can use naloxone sir. क्यों use करोगे naloxone? कोई rational बताओ ना. You also need to think, right? My dear students, you need to think very carefully. What is the rationale of using naloxone in alcohol? Alcohol में उतना use नहीं होगा. Okay, alcohol overdose में उतना use not there. Okay, so now what we need to understand, alcohol के अंदर, if it is methanol, what is the treatment? If it is methanol overdose, what is the treatment? If it is ethanol overdose, what is the treatment? Okay, so if methanol overdose, the treatment will be very simple. This is the overdose. Okay, and if methanol overdose is there, you can use ethanol. You can use ethanol, or my dear students, you can also use one more drug that is only called as fomepizole. 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 What is the name of the drug? Fomepizole. What is the name of the drug? Fomepizole. Both can be used. Fomepizole का mechanism of action is very simple. Mechanism of action is alcohol dehydrogenase inhibitor. Alcohol dehydrogenase inhibitor. Okay, what you are going to do? Alcohol dehydrogenase inhibitor. If there is ethanol overdose, then you are going to give what is that? Fomepizole only. Fomepizole only as an antidote. As an antidote. Apart from that, you can use other drugs. Fomepizole के अलावा you can give that is your thiamine. You can give diuretics, but specific antidote is fomepizole. Okay, what is the specific antidote? Fomepizole. Just let me confirm once if audio video is clear or not for my satisfaction. Okay, perfect. All right, everything is going good. So let's continue to the next one. That will be your paracetamol. Paracetamol. As soon as I tell everyone acetyl-cysteine, acetyl-cysteine, option में acetyl-cysteine itself is not there, then what will you do? ऐसा भी हो सकता है. That is why you need to understand. Okay, yes, paracetamol के अंदर acetylcysteine के अलावा, apart from that also we can give other drugs also along with that. I want you to understand that very carefully because many times there is a confusion. Acetylcysteine के अलावा क्या हो सकता है, कैसा होगा, what is the this thing. Okay, whenever there is a paracetamol, normally in a normal scenario, okay, what is that? In a normal scenario, paracetamol metabolized by two pathways. What are the two major pathways? Okay, that is, one is glucuronidation. All right. One is your sulfur conjugation. Okay, what will be there? Glucuronidation and sulfur. Now, during the overdose, what will happen? Zada paracetamol, a large amount of paracetamol. Okay, so during that paracetamol, so large amount of paracetamol go. So if large amount of paracetamol go, saturate the pathways. What is that? Saturate the normal pathways. Saturate which pathways? Normal pathways. What has happened? Normally glucuronidation and conjugation hota tha. But abhi itna zyada, this much large amount of paracetamol has gone that it will saturate the sulfur conjugation and glucuronidation reactions. Okay, so that reactions will undergo completely saturated, full. The reactions are full busy. They cannot take up more paracetamol. Still there is some pathway. So now what will happen? Saturate the normal pathway. So paracetamol enters into alternate pathway. What pathway? Alternate pathway. What is the name of that alternate pathway? That alternate pathway is only your microsomal reaction that will enter into CYP enzyme pathway, cytochromal enzyme. Because of that alternate pathway, it will produce a NABQI. NABQI. Okay, what is that? It will produce a compound called as NABQI. So this is a toxic. It is a toxic metabolite. This is what? Toxic metabolite NAB. These NABQI. So NABQI, my dear students, very, very important. That NABQI is the one which will cause hepatotoxicity. Hepatotoxic. Okay, hepatotoxic. So during the treatment, so you are going to check for one normogram. Normogram, a graph use karte ho. The name of the normogram is important. How to use is not important with respect to normogram used. Okay, so there is one normogram which is used. Normogram matlab ek graphic representation ko use karte ho. What you are going to use? A graphic representation is used. So that graphic representation, my dear students, that graphic representation is very important point which can be asked. Rumack Matthew normogram. वो graph को क्या use करते हो? That is only called as Rumack Matthew normogram. Rumack Matthew normogram. So a graph use karte ho. The graph name is called as Rumack Matthew normogram. And the antidote, my dear students, during this time you need to remember antidote is N-acetylcysteine. N-acetylcysteine. Along with the N-acetylcysteine, we also use one important substance, that is only your glutathione. Because during this metabolism, during this saturation, पूरा glutathione use हो जाता है. With normal pathways only, lot of glutathione has been utilized. So by giving the glutathione, it will help the normal pathway to work better. So there are two things which are supposed to be used. One is N-acetylcysteine and one more is your glutathione. And let's go to the next one, that is your benzodiazepine overdose. What is that? Benzodiazepine overdose. So all of you know benzodiazepines will go and act upon the GABA receptor, Okay, they will stimulate the gamma receptor and they will increase the frequency of again and again. Which receptors will be opened? Which receptor? GABA receptor. So benzodiazepines will open the GABA receptor again and again. That will lead to what? That will lead to chloride ion entry into the neuron. Chloride ions enters the nerves. Okay. Okay. So enters the neurons. Chloride ion neuron के अंदर आएगा, negative ion enters into the cell, automatically neuron will become hyperpolarized, means the neuron will become inhibited, so that will lead to hyperpolarization of the neuron. That is a normal mechanism. So this will lead to the overdose. During that time, patient can have bradycardia, unconscious, sedated, drowsy. All these are the clinical features. So the antidote, my dear students, you need to remember the antidote is flumazenil. What is the name of the drug we are using? Flumazenil. What is the drug we are using? Antidote is your flumazenil. What is the drug we are going to use? Flumazenil. Okay. That is the story of your antidote of benzodiazepine overdose. Then one more poison which I would like to discuss with you people, iron overdose. Iron overdose के अंदर I want you to understand two types. One is acute iron toxicity. What is that? Acute iron toxicity. Very good, Shubham Tiwari, you're correct. So now we are continuing the iron. Actually क्या हो रहा है ना, थोड़ा lag आने की वजह से आपको थोड़ा confuse होता होगा. But acute iron toxicity. Acute iron toxicity. ओके, अक्यूट आयरन टॉक्सिसिटी के अंदर इसका आयरन का चिलेटिंग एजेंट, चिलेटर यूज्ड, द ड्रग आयरन किलेटिंग एजेंट, मतलब आयरन को बाइंड करके निकालने वाला, बाहर निकालने वाला दवा, ड्रग which will go and hold on to the iron and removes out of the body during the acute iron toxicity, that is only called as deferoxam. What is the name of the drug? Deferoxamine. What is the name of the drug? Deferoxamine. What is the name of the drug? Deferoxamine. What is that? Deferoxamine. Okay. Then we have next important iron chelator. What is the next important iron chelator which you need to remember? The next important iron chelator, which is when we are going to use which one? Yes, of course, your other drugs. That is your, what is that? That is only your, most importantly, chronic iron toxicity. Chronic iron toxicity. So during that time you need to understand kab hoga. Chronic iron toxicity is occurs most commonly due to repeated blood transfusions. Repeated blood transfusions. Okay, during the repeated blood transfusions, the person can develop a iron toxicity. That will most commonly repeated iron transfusions are done during what? Thalassemia. Okay. Okay, so during that time, which are the drugs which can be used? Okay, so we have two important drugs. Okay, deferipron. What is the name of the drug called as? Deferipron. Deferipron अगर option में नहीं है, we have a newer drug that is only called as deferoxyrox. What is the name of the drug? Deferoxyrox. There are two drugs, that is deferipron and deferoxyrox. Okay, so these are the two drugs which are used for chronic iron toxicity, which can be used orally. Okay, two drugs, deferipron and deferoxyrox. Okay, so these are the story of your, what is that? Iron toxicity. Then if there is a vitamin B6, okay, so usually vitamin B6 के अंदर vitamin B6 poisoning कब होता है? I want to understand mainly what is the clinical features. बस एक ही इतना याद करो. So same as that of, इतना ही याद रखना, same as of deficiency, same as of what is that? Deficiency and overdose will have a same clinical feature with vitamin B6. So some clinical feature include peripheral neuropathy. Okay, then apart from peripheral neuropathy, patient can have anemia. That is which type of anemia? Most commonly that will be sideroblastic anemia is possible. So now during this time, what we need to do is that if excessive is there, stop B6. If excessive is there, stop B6. Okay, and followed by that symptomatic management. Okay, followed by that symptomatic management. So this is the story of your vitamin B6. Once you understood about that, the last one is tricyclic antidepressants. These are which type of drugs? Antidepressants. Okay, tricyclic antidepressants. Basically, these are a type of acidic drug. Antidote, what we are going to use is sodium bicarbonate. Usually what we are going to use is sodium bicarbonate during the treatment of what? Tricyclic antidepressant overdose. Okay, so this is the story of your, what is that? All the important, मैं तो ऐसा नहीं बोलूँगा कि all poisons have been, or all drug overdose have been done. I will not tell that. I am telling you very clearly, within the span of less than 2 hours, we have covered all the important last 5 to 10 years most commonly as drug overdoses have been completely clearly understood, and which will compose of 1 or 2 questions in every exam. Within 1 hour we are approximately within an hour we have completely done about definitely 1 or 2 questions guaranteed, and all 4-5 years all the drug overdoses have been covered from all the papers including FMGE and NEET PG papers. All right, so this is the This is how we are going to give you all the 19 subjects in our rapid revision program, bacho. That's why we have been telling you people. And price is also not very much, okay? It's a cost of 3 or 4 biryani since we give. That's it. बट जब पढ़ने के लिए आते हो उतना कम फीस तो भी सर वो भी फ्री में हो सकता है. सी वी हैव टू, यू हैव टू अंडरस्टैंड, राइट? आई एम नॉट ब्लेमिंग एनीबॉडी, आई एम टेलिंग यू पीपल, राइट? नीड टू अंडरस्टैंड, दैट्स इट. अगर एक बॉटल खरीदे, एक बॉटल का कीमत से कम है यार कोर्स का फीस. It's around 999. 999 is less than many expensive liquors actually, right? So here what we are doing is that we want to give our content in a concise, short, sweet manner, and we want to make sure all our students pass. Okay, so we will teach you people all the important components in that particular rapid revision program, so that what you can do is that you can revise your notes also. Along with that, we will give a rapid revision. So we have the material of the rapid revision. You have done your material, rapid revision is done, you are getting MCQs, and this course will continue till the exam. ओके, सो दिस इज हाईली रिकमेंडेड. एंड नंबर ऑफ आवर्स, अगर मान के चलो कोई बड़ा सब्जेक्ट हो गया, विल नॉट एक्सीड सम 20-30 आवर्स भी नहीं बनाएंगे, उससे भी कम के अंदर, इवन विद इन लेस देन दैट, वी वांट टू कंपोज all the short, all the important information into one place and give you people. So hope to see you in our rapid revision program, which is exclusively available on the Meduhub app. All of you might have by now. Okay, if you have any difficulty, you can connect to us, our team, or any of us. So you know how to contact us. Most of you have our numbers. Okay, we'll you can connect directly to the team Meduhub. So team Meduhub, anywhere in any platforms, it is there. In Telegram, we are available everywhere. So you can join and you can utilize the use of this program very well. Hope you enjoyed today's session. Thank you so much. And I can guarantee you one thing, definitely 1 or 2 questions will come from this session, definitely within this short session. And ऐसा content है, कभी भी आप लोग इतना concised manner में, you might not have seen with the detail, but it concise manner of discussion of the drug overdoses and their treatments. Hope you enjoyed today's session. See you people in next session in the Meduhub app, right? So that is starting from 2nd of July. Okay, so see you people. Hope to see you in the rapid revision session as well. Thank you so much guys. Bye bye. Good night. गुड नाइट नहीं है, जाके आप पढ़ लो, ठीक है? ऐसे मत रहना. अब इसका सर पीडीएफ कहाँ से मिलेगा? इसका पीडीएफ भी मिल जाएगा, कोई दिक्कत नहीं, ठीक है? इसका पीडीएफ विल गेट. ओके, सो we'll give you the PDF also. Sir, how do we get it? So you will do one thing. But today we'll send you the PDF. By tomorrow morning, you come back to the same video. You come back to the same video. Open the description of the video. अगर पढ़ते हो ना, कोई अच्छा सिंगर दिखने वाली अच्छा सिंगर दिखती है तो अरे कौन है ऐसा नाम ढूंढते हो ना डिस्क्रिप्शन में जाके, ऐसे ही अच्छा पढ़ाया वो डॉक्टर मारुति सर का जाके डिस्क्रिप्शन में देखना चाहिए. वहां पे एक ड्राइव का लिंक रहेगा. इन द ड्राइव लिंक दिस नोट्स विल बी अपलोडेड सून. ओके, सो वी विल अल्टर द डिस्क्रिप्शन के अंदर ये नोट्स अपलोड करवा दूंगा मैं, ठीक है? ताकि आप लोग बैठ के लिखने का जरूरत ना पड़े, जल्दी जल्दी पढ़, ठीक है? थैंक यू सो मच. बाय गाइस. Good night, Shubhratri, spokojnej noci, do svidania, bye bye.